Now, what if I told you that if you were suffering from knee pain, specifically anterior knee pain, something we call patellofemoral joint pain, that I could give you a really simple way of taping that knee to take away 90% of your symptoms? Wouldn't that be worth a try? Well, my name is Nigel, expert physiotherapist, and basically what we're looking at is the structure of the knee related to the patella. Now, the patella is that kneecap that sits within the tendon at the front of the knee, and sometimes people get a lot of pain from the interaction between the kneecap and the underlying surface. This can happen for a variety of different reasons, but it can be quite uncomfortable. Now, the classic way that this is presented is that it is really painful, specifically at the front of the knee, and it's particularly worse on, say, walking downhill or squatting down, because when we do that motion, we basically squeeze the underlying surfaces. So as a short-term measure, while we're trying to get better in terms of the overall problem, we can make ourselves improved in terms of the pain by using a little bit of tape. Now, tape, what I mean by that is kinesiology tape. Now, this can be picked up anywhere now, chemists, online, all sorts of places. But the key thing about this tape, if I just take the back off it, is it's stretchy. It stretches like that. So it's not a tape that is restrictive in any way, but it's supposed to do all sorts of things. But in my opinion, what it does is it can help support tissues and actually increase the feel and the sensory information around an area. And so I have found it quite useful in reducing pain around the anterior knee. So I'm going to show you in a second how to do that. Now, it's very important that if you use this type of tape, that you do it in a safe way, and that is that you shouldn't have any skin irritation to it. In fact, it's very rare to have skin irritation, but it does happen. If you get any redness or symptoms of itchiness around the tape when it's on, then just take it off. You don't want to have an allergic reaction. Otherwise, if it feels okay, it's the sort of tape actually that you can get wet in the shower. It will stay on. Olympic swimmers use it all the time, for example, so it should stay on. And also you can keep it on for a good 2 or 3 days, so it will help to unload those structures and then make that pain better. So now I'm going to show you how you apply 2 strips of this tape to your knee to make it feel an awful lot better. So let's get on with that. So very simply, when it comes to taping for the patellofemoral joint, we usually get our best effects by unloading the kneecap from the underlying structures. So we use 2 strips of tape, bend the knee up in long sitting. Now, the idea of this is that we are going to take the tape and stretch one piece around one side of the kneecap and then the second piece around the other side of the kneecap. And that basically means then the kneecap sits nicely within this lifted support, which then unloads it, especially if we do things like squats. So I'm just going to tear the first piece off now with our K-tape. We're going to do it on stretch. So basically starting on the underside, pulling to stretch the tissue round and going all the way around one way. And then the second way around the other side. We can start from the top as well. It doesn't really matter. Work it around the area of the kneecap, and then the kneecap sits nicely within this zone, this circle here, which means that it's less likely to be pulled from side to side, which can be problematic, and it's going to unload the kneecap a little bit in theory when we do a squat. So that's worth trying.